Look. Hello and good evening, everyone. Welcome. My name is Mira West, and on behalf of the entire team at the Foresight Institute of Research and Translation, I am delighted to welcome you to the official launch of our Mental Health Dialogue Series 2025. Tonight, we are kicking off this series with a vital and timely theme. From research to community action in mental health, bridging research and community solutions in mental health. When a crisis hits, access to mental health support is critical. But how do we ensure that the support we provide is effective, inclusive, and truly rooted in community needs? This launch event will explore how research can bridge the gap between academia, policy, and lived experiences, empowering communities to build resilience and healing. To explore this topic, we are joined by an outstanding panel of speakers. First, I'd like to introduce Mr. Elie Uwimanduhay. Mr. Uwimanduhay is a third-year medical student at the University of Rwanda and a passionate mental health youth advocate. He serves as the International Relations Manager in AIESEC Rwanda and is a 2025 Millennium Fellow, leading a project focused on addressing stigma and fostering resilience among youth. We are also joined by Ms. Ololade Awaye. Ms. Awaye is a practicing psychologist and a program officer at the Women's Advocates Research and Documentation Center, WARDC. She is a dedicated trainer and therapist with extensive experience supporting children, young adults, and marginalized groups. She is also a Nigerian mental health fellow and is certified in cognitive behavioral therapy. And rounding out our panel is Ms. Bisola Oladele. Ms. Ololade is a mental health advocate, researcher, and importantly, a peer expert with lived experience. She is the advocacy team lead at Talk to Heal Foundation in Ghana. Her work spans training community and peer support workers, health workers, and traditional and faith-based healers, and she is passionately committed to supporting people living with mental health challenges. And of course, we need a skilled moderator to guide this important conversation. We are thrilled to have Ms. Owoisinke Victor Archibong as our host for this evening. Ms. Archibong is a public health professional and mental health advocate with a passion for transforming research into real-world community action. She is the founder of the Health Wave Initiative, a platform dedicated to promoting mental well-being, awareness, and community empowerment across Africa. With a strong background in leading mental health dialogues and developing evidence-based interventions, Ms. Archibong's work centers on translating research into actionable solutions that strengthen mental health systems. She actively contributes to collaborations that bridge science, policy, and lived experience to drive mental health impact across the continent. We are in excellent hands tonight. Please join me in welcoming our panel and our moderator. Ms. Archibong, the floor is yours.
Good morning, good evening, good afternoon to everyone, wherever you are. Welcome to the launch of our Mental Health Dialogue series on FIRAT. So, thank you so much, our able speakers, for joining us this evening. Thank you, our audience, for taking the time to join us on this dialogue series. So, at FIRAT, our mission is to bridge the gap between research, policy, and community actions. And our mental health launch series has this as our vision. There's going to be a platform for dialogue, learning, and sharing insights amongst researchers, youth advocates, practitioners, people with some lived experience, and researchers. For our first team of events, we are having the From Research to Action, bridging the gap between evidence and community healing. We want to bring this knowledge closer to the people. We want to take the knowledge from the research papers, from the policy dialogues, down to the people that are really going to be affected by this policy. We want to provide practical interventions. We want to tell people about reality checks, what can be done, what can be relatable to our communities. So thank you so much, our able speakers. We have our three speakers already here. And today's session, we're going to focus on this discussion from each of our speakers. So we're going to give our speakers 10 minutes each to talk about their angle, and then we'll leave the floor open for discussion and also hold a panel session. If you have questions, please put them in the chat box and we'll get to them after that. But so for our first speaker, which is going to be Mrs. Ololade, we leave the floor open for you. Thank you very much.
Hi, good afternoon, everyone. Can you hear me? Hello, can you hear me?
Yes, we can hear you. You have the floor, please.
Okay. So I just want to confirm you can hear me. Hi, everyone. Good evening. My name is Ololade. I am not a Mrs. yet. I'm just Miss Ololade. So,
Apologies,
permit
please.
me. Oh, that's fine. That's fine. So I'm trying to set off my camera. Um. Okay. Can you confirm you can see me? Can you see me?
Not yet.
Okay. So, can you see me now? Is this better?
Yes, please. We can see you.
Okay. So I'm in a dark place. I had to use this ring light. So the bulb just went off and it's just very, very annoying. Not at this point. Okay, so hi
So sorry.
everyone. Good evening. My name is Ololade. So we're going to get right into the conversation because I've been giving 10 minutes. So I hope 10 minutes will be enough to basically talk about what I have prepared because the conversation is deep, right? And 10 minutes is enough to start it, but let's see how that goes. So I like to make presentations very interactive. So I would at any point, I think you'll be the only one reaching out to because you can see here, and you're the only one that I have. You're the only one whose voice I've heard today. So if you can hear me, I want another person. If you can hear me, just say hi. Just say hello. Okay.
Hello.
Okay, I can hear. I can. Oh, hello, hi. Okay, perfect. Okay, because I had a baby. Okay, so we're going to be talking about bridging the gap between evidence and community healing, right? From research to action. So this topic is very dear to me. Reason being, I work with communities, right? And as a psychologist and a mental health advocate, I do a lot of community engagement. It is part of what I do as a volunteer because I love to volunteer. You know, when you understand the gravity of an issue, you would do everything possible in your power to basically create that awareness, take the knowledge you have, take it across the globe if possible, right? So gradually, I believe in attending to your immediate communities, your immediate community, in fact your close community. The very first person you can say, that's your family member. So I'm trying to share my screen so this conversation can be interactive, so you can basically see what I am saying as I am saying it. So let me see, how do I share this? Okay. Okay. I'm trying to share my screen, so this is very, very odd. Or do I send the presentation to you if it is possible? Um, can you see my screen, please? Can you hear me? Hello?
I can hear you, but I can't
Uh,
see your screen. It's looking blank.
It is blank? Oh, wow.
Yes,
Okay, let me see.
it's just dark.
Uh, it's just dark. That's definitely the
Yes.
network.
Can you share to me on
That's
WhatsApp? Let me see if
definitely.
I can share for
Oh,
you
perfect.
as you
Okay,
talk.
let me, yes, let me quickly do that now. So I can share it with you on WhatsApp. Yes. Okay, so okay, I just shared it with you. I just shared it with you on
Okay.
WhatsApp. But can you see me now? Aside the screen being, can you see
Yes,
me?
I can see you. Yes, we can see you.
Oh, perfect. Okay. Okay. Just let me know when you're ready so we can.
Okay, I'm trying to open it. Wow, I'm struggling.
You're unable to share it as well?
Yes.
Oh wow. Okay, so because of time, I think I
Okay.
would really like you to see the pictures I have because I have images. Okay, so let me see. Okay, so I have been able to I've gotten the parts where I can upload files, so it is currently uploading. So I think they should take like 1 or 2 minutes. This is rather too slow. It is still uploading. I don't know how long this is going to take.
Wow.
It is still uploading.
Okay. Is it still uploading for you?
Yes, it is still uploading. So
Let me share for you.
I think we can just. Have you been able
It's
to upload?
yes. Documentation. Okay. Can you see it?
Oh, perfect. Yes, yes. Okay, this is perfect. Okay, so hi everyone. So this is the internet age. So these things can be very difficult, and AI is improving every day. So the more we practice, the more we learn. So can you see me? Because I think I am frozen here. I don't know. I'm just looking at myself.
No, we can't see you, but
Uh,
we can see the presentations.
oh, okay. So
We can see you
yes.
now.
So I had to, okay, I had to get this very beautiful background because I'm a dark person and I'm in a place that is dark. Even this, my small ring light is not really doing justice, but please bear with me. So, yes, we're discussing bridging the gap between evidence and community healing. So, yeah, I was talking about how this particular topic it connects or resonates deeply with me because as a mental health advocate who likes to go into communities to basically create the awareness of mental health, this is something that we need to talk about. It's one thing to do your research on mental health, mental illness, the policy around mental health and all, but if you do not carry out whatever it is you've gotten your findings, if you do not bring it into reality, I'm sorry to say whatever it is you've done is just for knowing sake, because you're not actualizing, you're not spreading the knowledge you have, you're not basically doing something to prevent the findings from the research or research that you've done. So this particular topic is very, very important. Next slide, please. Okay, so now research provides valuable insights But the thing is, low and middle income regions in Nigeria, I'm using Nigeria as a case study because I'm a Nigerian and that is where I'm at. And that is the place I've done all of the advocacies and awareness of mental health. That's where I've done it. So if we talk about research, there are a lot of research, there are a lot of topics, there are a lot of things that basically piques the interest of people, especially those of us that are interested in mental health. And I want to assume we are all interested in mental health if we are in this particular dialogue. So you see, when you make your research, when you go into a community, for example, and say you want to learn how they cope or manage depression in this community, and then you've gotten all of your findings, you've done all of the things that you need to do, what happens after that? Because I believe it is the aftermath of the research that can actually bring about the change. So there is a need to explore the barrier of all of this implementation after the research, and now to implement all of these things, there's a need to tackle the stigma, because these are the things you find very common in our community. There is a need to understand the culture behind their idea, the perception about mental illnesses and mental health itself. Now, going into the policy, because this is just to introduce the research as a whole. If you're talking about research and you have to marry research and the change, your research and creating a conclusion, doing something that would basically bring about your research and say, oh, that person actually made a research on this. You want to be able to balance the bridge between your research and the evidence, and also making sure that community are benefiting from your research. It is one thing to make your research and another thing to basically just keep your findings to yourself. I have seen on different research sites where people would post a lot of things they've done in their communities, not just mental health related, but this spans across literally everything. But what do they do afterwards? Nothing. There is nothing they will do. For the medical people, after making a research, right, and they've seen that, okay, this thing contributes to mental illnesses, or it contributes to depression, or it contributes to high blood pressure, at the end of the day, what happens? They would come up with different ideas. Okay, we want to do this clinical trial, we want to do that. But in mental health, it is not really like that. The awareness, the prevalence is very, very low. So the mental health landscape in Nigeria basically talks about how 85% of Nigerians with severe mental illness, they don't know anything about it. Most of them do not even know what they are going through. They don't know what they're going through. So there is a part where if you do your research and you don't do anything about it, you're going to have a vicious cycle of the same thing happening over and over again. So it is very, very important we take cognizance of how mental health receives less than 1% of national income. Hello, can you hear me?
Yes, we can.
Oh, okay. Okay. I saw that the network went off. So in Nigeria, I recently attended the mental health conference last month. Was it last month or beginning of this month? I think beginning of this month. And uh, um, the advisor to the minister of health, I can't even, commissioner for health, yes, spoke about mental health and the plan the federal government has as regards to Nigeria in terms of prioritizing citizens' mental health. But that is by the way. It's good they are making all of this little progress, but then we need to take note of how in the national budgets mental health is, we don't they don't consider mental health as important. So the budget they will put for mental health is less than one. So this also kills the research that we are doing. Because if you do your research and there is no fund to basically carry out your research or progress like this continuity of the research, what have you achieved? Nothing. I'm very sure we are all familiar with the population of Nigeria being over 200 million, and we have just 250 psychiatrists. Psychologist is even small. We can't, because people are shying away from studying psychology. I can actually count how many people I know in my department, in my set, that graduated with psychology BSc, and we are not up to 10 that we are practicing. Because things I hear is, oh, there is no money there, psychology is not lucrative in Nigeria, you're just wasting your time and all. Please, the next slide. So, why do we need to involve community? Why do you think community engagement is important when it comes to bridging the gap between evidence and community healing? If we're talking about this, right, I've seen firsthand how research insights can remain distant from those that actually need it. You're doing all of this research, yes, it's good, that's very, very fine. But then, how do you translate evidence into action that will basically promote real healing? How will people tell that, okay, this research was made, and as a result of this research, everybody in this community prioritizes their mental health? That is just the gap. Over the years, mental health research has provided incredible data about trauma, resilience, and the treatment from all of these things. But then communities are oblivious. They don't even know this is even happening, or this has been carried out in their community. They have literally little or no idea. That's why we have to address all of these issues. That's why this conversation is extremely important, because the evidence is there, but nobody is ready to bridge it. Nobody is ready to connect the dots. So why do you think community engagement matters? Because there is the community stigma. I'm starting with the second one. There's the community stigma. There are cultural beliefs about illnesses. There's a lack of mental health awareness. I can remember when we went to a community in Lagos State, and I had to speak Yoruba. I'm a Yoruba girl, by the way. I had to speak Yoruba for this community people. And then you could see old people talk about, that's people in their late 50s, early 60s, and above. These people, they know to an extent what it is, but then when we started the conversation, they're like, so they do this thing in Nigeria, eh? So in this community, if you go to the clinic, you'll be able to see, you'll be able to talk to people, and they will not tell anybody. You'll be able to tell. You see, the one that is very, very prevalent that I can tell from clinical experience is the drug or substance induced mental illness. So these are the ones that are very, very common. They see it in communities. You see people that are addicted to substances, and you see them walking on the road and they are not really walking. You will see them like by the gutter. I'm very sure you're on social media, so you see all of these things. So what is the point of making your research, doing your research, and then you're not involving those people that are supposed to be beneficiaries of this research? You're not teaching them. You're not. These are the research to help you. So mental health awareness is very, very deep. That's why services are predominantly drug very important. Because if you go to some communities in Lagos and they tell you that the general hospital in this community is about five streets away, 10 streets away, to get the to it's not easily accessible. And there's that stigma, which is like number one and number two are more or less intertwined. Because if you go to the hospital and you're talking to the doctor about not being able to sleep, having negative intrusive thoughts, and it is beginning to affect your business, affect your family, affect your work, affect all of these things, then there is that part of, okay, when I leave the hospital, if I see my neighbor there and the neighbor sees me that I'm coming from the behavioral ward. I did my NYC at the clinical Kara State General Hospital. I worked as a psychologist at the behavioral ward. I know all of, they don't have to use their mouth to say it. I know the way they look at you, that and this one's coming from this place. This is where they put mad people. So you know all of these things are very, very important for community to know. So this what you're doing is to reduce the stigma gradually. You are ensuring that people in that community, they're very, very intentional about their mental health of the slide. Anyone hear me?
Yes, we can hear you.
Hello.
Hi, we can hear
Okay,
you.
okay. So, okay, so my network is very, I don't know what is wrong with my network. I can see you, but I cannot hear you, and I am frozen. I cannot even see myself. I am frozen. It's just showing black. Can you see me? What is wrong with this?
Yes, I can see you and we can hear you.
Oh, perfect. Okay. So now, evidence in action. This is the happiness intervention. So the happiness intervention basically would help provide a pathway, a guideline to how we can bring our evidence, the research, the findings from the research, and make it an actionable goal. You're not just doing anything for doing sake. You're not doing your research because you want to be part of those that have done that research somewhere in Lagos. You are very intentional about your research. Obviously, you will do everything in your power to basically make it um, um you basically make it for you make them benefit from it, because your research is one thing to help you find reasons why they should prioritize mental health in communities, why people are not talking, why there is high rate of depression, why there is high rate of suicide, why people is going into substances, drugs, just to avoid thinking of certain things. Your research, and it is very, very helpful if you can start bringing in people in this community, basically talk about, okay, Bale, as the imam, as the pastor in this community, you're a very known person. People go to you when they have issues. Now, as regards mental health of people, these are the things we've observed. We want to do something about it. I remember I went with anti-suicide and depression squad to Ijora Badia community, and we went to create awareness of mental health. We had to sit down with the chiefs of that community. We had to tell them that these are the things that we've seen. The youth in this community, they are prone to doing acting out of character. They are prone to doing certain things in their community that brings or creates a very bad look for the community. How do you think we can manage this situation? So examples of managing peer support groups, having trauma informed community programs. These are the things that we went to do. So if we have communities that are involved in the process, you are not sidelining them, you are not ignoring them. Emphasizing on research, because that's literally what the topic is about. We're talking about research. How do you out of your research? How do the community should prioritize their mental health from your research, regardless of what the topic is? We want to be able to give them solutions to whatever issue, whatever problem, whatever it is they're finding whatever it is they're finding difficult in terms of their mental health. That is why I am emphasizing on this. So initiative where community has input and ownership, this would lead to sustainability. So you know that community, they are involved in this. The ballers, the mothers in that community, they are involved in this because they know. When I was talking, I had to mix Yoruba and English because I'm a Yoruba girl, but I don't really speak Yoruba like that. I understand, but I'm not really fluent in Yoruba. But I did my own research speaking, creating awareness of mental health in Yoruba. So you can imagine the level of intentionality. I was very, very particular about creating awareness of mental health to this community and others. So if you can include community people, include them, people with lived experiences, if they are comfortable with sharing their experience, we can invite them, talk to them about it. Ensure that, okay, I'm from this community. At least I can remember one or two persons who have basically showed their interests. They are very particular about sharing whatever it is they've gone through. They've healed to an extent, and then they want to use their experience to teach others. These are the things you would get when you involve community. Don't just do your research. Make sure with your research, you can find a way to balance it. Successful intervention begins with respect and deep understanding of local context. I'm a Yoruba person. Before I went to Ijera Badia, I had to check, okay, these people that stay in this community more, I saying there's a need to basically speak their own language. I'm not saying you speak Yoruba, I'm not saying you speak Igbo, but make it relatable. Don't start speaking big English and tell them the data has revealed this, to this, according. Those just, they are by the way. They are not the cocoa of the Euro. If you're a Yoruba person, you understand that. The way they understand it's that the lamest you can ever think of. Understanding the local things that would help. These are the things that would make them understand that, okay, this is what she's talking about. This is how I can protect myself. There is also the social economic structure in that community as well. So if you're talking to them and you're explaining to them how all of these things are affecting people in the community, break it down. So people in this community, most of them are traders. How do they prioritize their mental health? How do they understand the signs and symptoms of a mental illness? Your research is good, but then how are we making it something bigger? These are the major challenges. I like that you're speeding me up gradually. I like it. Please go back to the next slide. So this is putting me on my toes. Thank you very much. So these are the major challenges, right, for community engagement, involving community, and the things that would deprive one from involving community. Like I remember there was a test to Jos. We went to Jos to basically research on the identifying barriers for freedom of speech for women and how it affects their mental health. We went to Jos to do that research. And most of the women that I spoke with, their findings from the KII format interview and the what's it called, the group interview and all, I was able to understand how conflicts affect one's ability to make a decision. So creating a community, what you're doing is you're bringing up change makers in that community that understands the topic well, people that are very particular about prioritizing their mental health. These are the things that you would bring from it. From this community, you are bringing people that are, you don't, if the community is a very big one and you don't want to train everybody, or you don't have the funds or the time to train everybody, bring people from that community that you know, okay, you have done your research, this is the findings from the research, how do I prevent this from happening in this community based on the findings on your research? So community engagement act as a crucial, please go back, they act as a crucial protective layer, achieving several objectives. The first one is it helps to safeguard health workers through local intelligence and trust. Like I said, you are involving everybody, teachers, doctors, farmers, you are involving those that are doing the vulcanizers, you are involving them because these are the people in the community. You are looking at everybody. You are to make sure, okay, you don't want to make it only your community. You are bringing everybody you can think of to this particular intervention. It's not just you. When you involve these people, I tell you that it is going to create a level of sustainability. They would want to do whether they like it or not because they were in the formation of the program, of the whole process.
Please, we have
Let me
one
go
more
to allow you
minute.
say it. I can see your face. My time is running up. I have 1 more minute. Okay, so
Yeah.
let me. I know you very well. I've seen your face. You don't have to talk. Okay, so it promotes safe crucial mental health services even in unstable environments. It allows us combat dangerous misinformation with culturally tailored communication and trusted local messengers. So when you teach these people, they will be the ones to tell you that no, that's not true. They will be the one to correct your misinformation. They will be the one to tell you, okay, this is what I have observed. I know in just we have change makers, women that are very intentional about security, women participation in family matters and in governance matters in their area. So why do you need to involve psychologists in this? Why do you think why is their role important in community engagement? Translating complex clinical knowledge into actionable, culturally relevant supports would help. It would meet the needs of the community. Like I said, not too much big language. You're not speaking too much grammar. When you bring psychologists to train community health workers and faith leaders, like I said, invite the pastors, the imams, the chiefs, everybody. This would help them to provide. They would not wait till the problem is very big for the community. Once they know that there's wrong in that family, is that that girl that used to laugh, that is always greeting us on the street, we have not seen in a while. They will reach out. What's wrong with that girl? Help us check her. Hope she's okay. That is because they know this person is acting out of character. But if you carry all your research and you don't involve communities, it will just be there. You will have the vicious circle of the same thing happening over again. So policy advocacy, these are the people that would be public press statements released. I know government, they do this if they want to sign something into bill, they'll do like a press statement where every community. When it comes to mental health, they'll be able to say something. That is because your research in that community, you what it means for this community or communities in general. You have involved them so they know. Please, the next slide. Okay, so you can skip this. I've explained this. You can skip this. The next slide, because I you said I have 1 minute. So yes. So this is the conclusion. From research to healing, it's not just having your research. It's not just doing your research. What happens after that? What happens afterwards? What is the most important thing that comes after you've done your research? It's very, very important we know that psychological wellness is a right, it's not a privilege. Our mental health is equally as important as your physical health. If there is something wrong with somebody's physical health, the person is unable to work. The person would not go to work, yes or no? Because you cannot work. But if something is wrong with the mental health, you will still struggle and say, uh, there is absenteeism, you are there physically, but your mind is not there. There's a presentee, you are there, but your level of productivity is that you're not doing anything. These are the things that we need to start prioritizing, because I have met market women that they will tell me that, oh, I was in my store and somebody came to buy something and the person was in my front. The person has paid and I collected the money and I was just holding the money. My mind was, these are market people, these are women I would cut your very. So if you do not involve, I'm emphasizing on community, and emphasis lies on the rural areas. People that are not really, you can't see them, they're not in the urban place. They don't really have the level of knowledge that we have. They don't really have the understanding. So carrying our research and taking it to them would basically help them heal. To sustain progress, we must train local advocates. I mentioned the change agents that we created in Jos. We can get change agents in these communities as well. We can tell them, make data accessible, tell them the number of young people in this community that you visited, how maybe 10% of people in Surulere community, how about 5% of them went into drugs, how 5% of them, about 3 of them attempted suicide. They did not die by suicide, but they attempted suicide. Bring people with lived experiences, let them just talk about all of these things. You are bringing your research into reality. You're not just keeping it in one in one document, in one folder, on one page online, they can actually see the aftermath of this research. So, in conclusion, this is a mental health action in Nigeria and beyond. We have to join the healing for all. Very particular and intentional about mental health. I'm very sure you can tell by the way I'm talking. I use all of my energy when I'm talking about mental health because it is very, very deep. If we can work on our mental health in this country, we would gradually reach the world in general. But if we ourselves, right, if you don't take, I'm going back, your immediate family is your community. With your mom, your dad, your siblings, your uncles and aunts, help them, teach them. It's going to be difficult to reach the community. Let's start by encouraging everybody around us. Let's start by talking about what we have found out from the research that we have done. Let's bridge research and healing. Let's take from data to dialogue. Have difficult conversations. Talk to people about their mental health. Don't just say, oh, nobody's talking about it, so I'm not going to talk about it. Have that kind of conversation. Let them know that this is what I have seen. From your insight, from your knowledge, from your understanding, move it to impact. Be the change that will bring about change in your community. From your research, build relationships. Collaborate with people. These are the things I found out. What do you think we can do? Which community do you think is easy to reach? Which one do you think would accept our conversation? Let's ensure mental health care is evidence-based and community-owned. This is extremely important. I've mentioned it, and like I said, whatever it is I'm saying now is coming from clinical experience.
Thank you so much, Miss Ololade. This was a very, very impactful and interesting session. We can actually see that you're very passionate about mental health. And thank you for taking your time to prepare those beautiful slides and for telling us all about it. We know that research actually gives us the what to do, but the action lies with the community projects. There's so many research works now that actually tell us that we need to take it to the communities. The communities need to be active partners so that the results will be stronger. Thank you very much. And as our time is fast spent, please we'll leave the floor open for Miss Bisola Oladele. Thank you. Please, can we try and keep to time? We have 10 minutes. Thank you.
Hello, good evening. Can you hear me? Hello, can you hear me, please?
Yes, we can hear you. Please go ahead.
Yes, we can hear you.
Hello, all right. Sorry, my
No, we can hear.
internet connection is very poor here. Okay, so my internet connection is very poor here. Please just bear with me. And thank you very much for this opportunity to speak. And thank you to Firat. Thank you for the opportunity. Thank you for this kind of platform that you have created. And also to the first speaker, I must commend you because I really learned a lot through your presentation. Thank you so much. So just to hear my view concerning the theme for this webinar series, which is talking about bridging the gap between research and community healing. I would just like to be practical, and I'll be sharing some of my experiences, both as a researcher and my involvement in community engagement. So beginning with research, I'm part of a research work, and we are doing research on how to care for people living with psychosocial disabilities. And one thing that actually this research, we have two things that are unique about it. The first is the community-based rehabilitation that we are doing through this research. So this time around, we are not doing an institutional rehabilitation. We are not doing an institutional care. We are doing community-based rehabilitation. What do I mean by that? We are actually going to communities to meet the people that are in need, the people that are really living with psychosocial disability, and we are looking for ways by which we can help them within their community. Now, this is not like bringing them to the hospital. No, we want to meet their needs. We want to care for them right in their community. So that is one thing that is unique about the project work. And the second thing, the second unique thing is the term I refer to as co-production. What do I mean by co-production? I mean by the coming together of experts, expert by profession, expert by training, and expert by lived experience, people that have really been involved, people that have really experienced this psychosocial disability. Some of them has come out of it, and some of them are still living with it and managing themselves. So we are bringing in their voices together with people that are trained, maybe the psychologists and psychiatrists and all sorts. And also we are involving some stakeholders like community leaders and traditional leaders and faith-based healers, and also people representatives from ministries, maybe ministries of women affairs or ministries of education. So what are we doing? We're just bringing everything together, everybody together, so as to make sure that our outcome, which is improving the quality of life of these people, is achieved. So this, it cannot be done by just a person. This cannot be done by just a group of people, of a particular set of people. We want to involve as many stakeholders as possible, so as to make sure that our outcome is achievable. So, as I always say, nobody can do this alone. We need collaborations from people, and that is what we call co-production. So in my course of research, I've discovered that there are so many knowledge gap in the community. People don't really know what mental illness is. In fact, even the educated can't differentiate between what mental illness and mental health is. So that is even the first thing we address, especially when we go into community engagement. We gather these people together in the community, these people that have said, all the stakeholders, everybody into a maybe community town hall or whatever area. And what the first thing we do is to lecture them that mental illness is different from mental health. We tell them that everybody has mental health, but when there is a particular deviation, when there is a little challenge regarding our mental state, that is when we have people living with or showing signs of mental illness. So when we start this, some of them some of them were amazed, some of them were like, so this is what this thing is really is. So we try to water down that stigmatization, that stigma surrounding mental health, because even if we go for data collection and we just introduce ourselves and we say we are here for mental research, they will just say, oh, we don't have mental here, that. So the challenge majorly is that people don't even know. They can't differentiate between mental illness and mental health. So that is the first thing we do when we go into communities. And when we do this, then they will be more receptive and they will be ready to listen to us. So these are the what we do in our research work, by going into the community, doing awareness, sensitizing people, telling them what mental health really is. So when we back to my research now. So we collected data from all these people that are living with psychosocial disabilities, and presently we are doing intervention for them. And what is the intervention? We are making sure that all the parts in the community-based CBR matrices, all the section there, we make sure that each of these persons that are living with psychosocial disability have access to them. For example, we have the social life. We make sure that there is a community, there's a peer support group where they all gather together to speak their mind and ask questions. And this has helped their social life too. So we are not just saying, come to the hospital, come and get medication and go. No, we want them to be fully involved. One of the definition of mental health is to be productive. We want them to be productive in their community. So that is why we are taking this care, this empowerment into their community with them, so that they will be able to mix with others and there won't be at least stigmatization will reduce. When you sensitize people, they know more about that thing, and this help to reduce stigmatization. So they have community group. We help them in livelihood. What are you interested in having? What are you interested in doing? Do you have any business at hand? Are you doing anything currently? How can we help you? And also, so we want to make sure that they have something that they are working on. That is, we are building hope in them. We are boosting them that you can work on yourself, you can earn your living. It's not because you are having this challenge, doesn't mean that you have to be begging around the community. What is your area of interest? What do you like doing? And by this we are able to help some of them, and some of them presently are working. Some are into business, some are into one thing or the other that is fetching them money, and this has helped them also in their livelihood. Another aspect is education. Some of them are involved in continue or funding their studies, and we have helped them in this aspect too. And regarding health also, we have helped them by doing hospital accompaniments with them. When their time to visit the doctor comes, one of us will go with them and help them in reaching out to the doctor, in telling them their symptoms, what they think, and all sorts. So we made sure that all these aspects are touched regarding their life, so as to make sure that their quality of life improved. So these are really the work we have been doing in bridging that gap. We are not just staying in our offices and collecting data, transcribing and writing policy brief and writing papers. No, we are making sure that our impact is felt in the community itself, and we have testimonies showing forth for it. So I would like to advise people, especially people that are into research, that it is not enough for us to sit back at our benches, at our desk in the office, type out in using our laptop, transcribing and analyzing, coding, and all those things. It is much more than that. Let's try and reach out to these people in their community. When you do this, people are more sensitized. Some of them are not even aware there is a medical care, there is medical treatment for people living with mental illnesses, even in the hospital. So these are some of the things that we lecture them on. Some of them are surprised that they can even get help from the hospital. Most of the people in the community we interacted with, what comes to their mind when we tell them, what do you think caused this kind of illness? They will say it is a spiritual attack. So, that's, to them, they don't see the need to go to the hospital. And the first point of contact for them is to go to their religious leaders. If you're a Muslim, they go to their imam, to their alfa. If they're Christians, they go to their pastors, they go to prophets, they go to the mountains to pray. If they are traditionalists, they go to their traditional healers. And what we do with these people is that we even collaborate with them. They are part of our studies, so that we sensitize them that it's not everything that is spiritual. Now, we are not trying to water down their efforts. We are not saying what they are doing is not good. Actually, research has shown that when you had your belief with medical intervention, the rate at which we achieve success is much more than people that don't have belief, but they just rely on their medication only. So we help them, we sensitize them that it's good for them to have the belief that what they are doing is working for them fine, and also it's not a sin to seek medical treatment also. So when we do this, we make sure that a larger percentage of people are reached within the community. So I'm just trying to be practical about what I've been involved with, and I'm trying to say that awareness is really important. It's really important. How do we reach them? Even without physical, we can go media. We go to radio stations, we speak about mental health, and we allow phone in, people call in and ask questions. These are part of what we do. It's not just writing paper, especially in this part of my country. Most of us don't read. They don't read papers. It's only academia that reads the academic that read papers. So when we want to reach a larger percentage of people inside the community, we have to do physical intervention, or we go to media. Because most people in this area, they listen more to radios. So we try to target where the channel of media that will be used for these people in the community, and that we have achieved through all these means. So I think I'll be stopping here right now, and I don't know if we have any questions for me. I'm ready to answer our questions. Thank you so much.
Thank you so much for that wonderful session. We will get to the questions session very soon. You've made us to understand that awareness is key. We need to take awareness to the very community that needs it. They need to hear, they need to feel, they need to know what is involved in mental health and mental well-being. So at this point, we leave the floor open for Mr. Elie. Please, the floor is yours. Hello, Mr. Elie. Are you there? Hello. I guess maybe network is challenging right now. So we really needed the youth advocates to tell us about the youth involvement in research and how they're going on with community engagement. Okay, so we have one question for our previous speaker. So the question says, having worked closely with communities and faith-based groups, what have you learned about bridging traditional beliefs with evidence-based mental health intervention? Hello, are we here?
Hello?
Yes, ma. Did you get the
Okay,
questions, please?
can you please repeat the question?
Okay, we said, having worked closely with communities and faith-based groups, what have you learned about bridging traditional beliefs with evidence-based mental health interventions? Hello, can you hear me, please?
Hello, can you hear me,
Okay.
please?
Yes, we can hear
All
you.
right. So, like I said earlier on, we have to sensitize people, and we try to make sure to
I think the network is very poor. We can't really get what you're saying. Okay, we'll come back. Mr. Elie, are you here? Okay, so we've heard from our both speakers about how to translate research from the papers to the community based. We know evidence alone does not heal people. We need this action. We need the community to be involved. There are so many research interventions itself that are falling short of this approach. We have so many information on what research is to be done, what interventions to be done, what work needs to be done, what policies need to be put in place, but we haven't gotten these interventions to be initiated in the hearts of the community. We know that when you involve the community, when you partner with these communities, you can make the intervention more effective and stronger. But there are so many factors that stand as challenges. We know that. But who are those people? Are those people really, are they ready to to carry out this intervention? There are basic interventions that really might not fall under those challenges. From both speakers, we've seen that peer peer support is actually a major way of helping reduce mental health issues in the community. We could start with those small mental health groups. We could go individually. Individuals can go into communities. You can train them. You can talk to them about what's going on. You can tell them what to do. You can help them to understand that when you talk about mental health issues, it's not that the person is psycho. It's not like the person has one incurable disease. Make them understand that these are their everyday things that you see, and maybe you don't know how to react to them, or you have a different reaction to them, or it's stressing you out. Is it the work you're going to is stressing you? Is it the school you're going to that is causing you problems? There are basic things you can tell people to do. You can tell them to eat well. You can tell them to drink water. You can tell them to how to live, the amount of sleep they can have. Those are basic things. Those are basic ways that interventions can go to the heart of the community. We know that, yes, we're looking for the big ones, but before the big ones come, we start with the little one. We start with the basic. We don't need just research, research, research. We need actions, especially in low and middle income settings, especially in communities, rural communities, where access to mental health services are very low. You can see that stigma is actually still the number one problem. It's still one thing that people are scared of. They don't want to be labeled like they are mad. They don't want to be seen as outcasts from the communities. But with these interventions taken to the heart of the town, they can talk to somebody. They can tell these practitioners what is going on with them, and they get basic help. They get the mental health first aid before they are being referred to the higher hospital officials, or to the doctors, or to the main person who is going to treat them. Thank you so much. Welcome back. Please, can you hear us? Hello, can somebody hear me?
Yes, I can hear you.
Okay. All right. So we're talking about bridging the gap between traditional beliefs and faith-based group. And we have another question here. Someone said, sorry, please hold on. I just saw that question now. Has any of the speaker worked with te- okay. Have any of the speakers engaged with teletherapy in the different communities for their work? Hello, Miss Ololade. Have you been engaged with teletherapy in different communities or in any community?
Hello. Hello, can you hear me?
Yes, we can
Mm,
hear you.
okay, I didn't get your question. Okay, is this the question here? Any of the speakers engaged with teletherapy in different communities for their work? Yes, I have. Yes, I've had online remote therapy, virtual therapy. So we've done that. Is there supposed to be a follow-up question after that?
Okay, I think the
Or
person
you
would
just
like
want
to
to
know
know?
how it works. Okay, what's
Yes, I can hear you.
uh
Please go on.
Okay, what are the thoughts about the same? What are the thoughts
What
about
are
the
their thoughts
teletherapy?
about the same, the teletherapy? So this is a very
Yeah.
good question. Clinical experience has basically taught me that not everybody um, is accustomed to the whole virtual session, right? While some people are very interested. Can you hear me?
Yes, please go ahead. Yes, we can hear you. Hello, Miss Ololade, are you there? Okay, yeah, before she comes back, Mr. Elie, welcome back. Are you are you good to go? Do we leave the floor open for you?
Yeah, it's okay for me.
Okay, please. You have 10 minutes. Thank you.
Okay, I'll be having to first share you with my screen and it will read. Uh,
Okay.
yes, let me first share you with my screen. Wait. So
You have issues sharing. You can share me your presentation or you can upload it. You can use the P, just press the P button on your laptop and it will show you presentation. You can't share your screen, but you can make a presentation.
okay, let
Have you seen?
me let me try sending it to you since I can see that it's coming to be kind of difficult for me to share it with
Okay, so you can
to
share it with
share
me and
the screen so like share it. Maybe you can share it for me.
okay, I haven't received it yet. But before the
Have you?
presentation loads, can you just give us a little summary of it? So, okay,
We
received. I've seen it. 2 minutes. Let me upload. Let me load that. Okay, please, Mr. Elie, you have the floor. Please, let's try and keep it within 10 minutes so that we'll meet up with the timing. Thank you very much.
So thank you so much for giving me a floor now to present about bridging minds and building resilience. Uh, firstly, I will have to tell everybody my name is Elie, and I'm a medical student, third year medical student at the University of Rwanda, and a public health advocate and enthusiast, and I'm actually the international relations manager at the AIESEC in Rwanda. So I'm proud to be here presenting you today in this uh, mental health webinar series launch. And today I'll talk mainly on the youth part and youth mental health advocacy part than research. I can see that the past speakers talked more about how to like bridge research and community involvement in uh, mental health advocacy. And right now, I'm going to add on talking more about how we could also include youth, how youth advocacy on mental health can really the things and how we should be also prior. So thank you for having me. And this I will say that within this presentation, we've got to understand all about mental health. According to WHO, you all know that mental health is a state of well-being where a person can be where a person will be having will be able to realize his potential, will be able to realize his capacity, and will be able to cope with normal life stresses and normal life well-being. So talking about key challenges, we're talking about these like key challenges that you face and uh, connecting mental health and youth. Uh, we can see that most of the time, different issues which eventually leads to their mental health crisis, and these issues usually goes with family, economy, and social challenges, and we usually connect them with these social media and digital overload, which eventually lead to substance abuse, and we can also categorize some coping mechanism like sleep deprivation as part of what causing youth to have these mental health issues. So can we go to the next slide? So why should we also talk about this advocacy? Why should we talk about mental health advocacy? Uh, First of all, uh, we should be considering advocacy since these mental health issues are very prevalent. According to the global ranking, we can see that suicide rates are increasing. It's not. We can see that more than 7,000 people globally uh, die of suicide, and this suicide is actually connected to these mental health issues. And when we do advocacy, we advocate which aim to like for dying of this suicide, and we when advocating for mental health, we are also uh, seeing this isolation of this youth who are isolated from other people and who like seek the help from uh, everybody who want to be heard. You can see that within more communities around the globe, most of the time you can find where be able to where you will be able to like express their emotions. You can see that within different communities there are different stereotypes around mental health. Where like talking on Rwanda's perspective, you will be seeing that somebody who will be expressing their emotions, especially guys or the boys, they will be they they are self their esteem will be like it will be like undermined. They'll be saying that you are not a man if you're in critical condition when you like rather communicate it or share it with your colleague and seek help. And the community will be pressing on the fact that you should be a man. They they usually consider bearing your burden to yourself as the true manship, and that's not good. And this is one of the cause of these mental health issues in the community. So, advocating for this, we want to build communities which will be helping everybody. We want to build communities where everybody will be we feel included, where everybody will express their emotions. So, what are the practical ways to promote this mental health? Uh, I'll be bringing about some self-care practices, especially for this youth, especially students. You'll be finding that in the times of exam, in the times of in the times of hunger, or whenever they are in critical conditions, you can be finding them have a nice sleep. You can find them like ex- y- you can find them. You'll be finding them isolated from everybody. So some key tips that can be helping everybody to maintain his mental health. I can say like having an adequate sleep, exercising a lot, I like exercising different mindfulness exercises. Like for many people who are students, I usually advise them to use Pomodoro. Pomodoro, I don't know whether everybody understands it, but it's a way of studying where you'll be having you'll be having a deep study time, but also you have a time for refreshing, a time to like think of yourself. A time to like instead of taking 5 hours to 5 hours to dangle your files and go through your slides, you can be like taking us and then 5 minutes, uh, 20 minutes to to maintain your mental stability. Uh, Another way to promote mental health is uh, these support systems where it can be family, it can be friends, it can be a religious group whom you are connected to, which will be guiding your and with whom who will be able to like strengthen you in the times of stress, in the time. yeah, in the times of stress and anxiety. So another way is this of seeking for professional help or this medical help, going to the hospital, going to the clinic to ask uh, ask counseling, or to have going to the clinic so that they can manage your mental health issues is not a problem, but it's a kind of medical care. It's part of medical practice, so we should be also going there for regular checkup so that we can maintain our mental well-being. So can we go to next slide? Yes. Since I'll be stressing a lot on youth and mental well-being among the youth, I've come to realize that many youth mental health issues are connected with this digital well-being, where you find that much of our times, much of the Gen Z's time is spent in uh, on the social media platforms. We spend them watching reels. We spend them seeing different people how they live. So I came to bring some practical tips that will be helping you to cope with different mental health issues, like when sorry.
Should I go back to the initial, or should I go
Yes,
forward to the next slide?
yes, the initial importance of digital well-being.
Okay, okay.
So we I would advise youth to like limit their screen time, since most of the time you find that youth, especially those with smartphones, you find them spend their time on the social media and on the screen. Uh, I usually see my dear brothers watching movies all night, and you couldn't imagine how the next day will be a mess. And uh, it's kind of one of the habits that can promote health. If you limit yourself to the screen, uh, if you have like a schedule of how you'll be using your phone, and you prioritize your daily schedules than having a lot of screen time, that would be very good. Another thing that would be like engaging in different mental health education, like education groups, and being connected to different communities that will be that can help you, like that can help uh, that can promote your mental health well-being. So the next slide. So the here now we are going to talk about this from research to action. Uh, our topic of today was also it was concerned about research and how research could be. Uh, yes, sorry for that. Can you hear me?
Yes, I can hear you.
Yes, I was saying that our topic of today was from research and bringing the gap between evidence and community healing. Talking about then how research can influence, how research should be community based, how research could act in promoting mental health among among these young men and women, among these youth. uh, we all know that research gives us knowledge, and is it's actually in the medical setting. You get find that research is everybody, everything that was researched on is the the information the information from research should be like based on policy making. The information from research will be will be based on in different strategic planning. So since research is kind of evidence that will be able to to help in strategic planning for every single government. We can see that translating how these people in the community feel, how these youth in the community are feeling, getting to do more research within the communities. Actually, in Africa, you get to find that we are doing more researches, and you get to find that even our healthcare system, the information that we are using is not based here in Africa. You get to find that during our strategic planning and during our healthcare system policy policy structuring, you get to find that we usually depend on this information from outside Africa, and so promoting research, but which is community based, we be able to. It will be it will help us to like do policy, but which is evidence based, which is based on the real problem within our communities, the real problem that these youth of ours are facing, the real problems that these young people, these old people within the community are facing. So, as research gives us facts and it let us know how the community lives, then working on this, using this evidence to promote empathy and to promote wellness among the mental health wellness people of our continent will be such helpful. And we should also not we should also include these young men and young people within this policy making. We should be these young women should be also considered when talking about policy. They should be engaged within these researches. Uh, they are the this continent of ours. They are the future policymakers. They are the future members of this global. So they should be considered in every single instances. So drawing up to conclusion, I can see that mental health is everyone's responsibility. So it demands collaboration among different sectors uh, of the setting. So everyone's commitment, everyone's contribution means a lot on promoting mental well-being. And as the key definition of our health says that uh, health is actually physical, mental, and social well-being. You 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 can see that health is a holistic thing. without without mental well-being, you can say that you're having health. So to promote well-being, we have to work together. We have to prioritize these issues within our communities. We have to see how these communities of ours are living, and based on the evidence within our community, based on the day-to-day interaction we have with the community. Uh, I, I'll be giving you like a real time experience within this past week. We did have a campus mental health uh, awareness activity, and we was privileged to be having our host today as one of our guests, and it was a mental health activity in the mental health awareness activity in the campus of ours, and we did also go for we did also go in the high school for this awareness activity. But seeing from its highlights, you can see that there is still a very great gap in the understanding of the basics of this mental health. You can see that people are always afraid of speaking of their emotions. You can see that people around the community aren't like ready to express their emotions, and there are different stereotypes within the community which are like preventing everybody to be open, and this need urgent action so that we can like we can promote health. So uh stressing to this call to action, I can say that uh less bird generation that is not only educated but also which is also emotionally resilient, compassionate, and this will be paving a way to a healthier future for all. So thank you
Thank
so
you
much.
so much. Thank you so much, Mr. Elie. That was so educating there. Thank you for telling us about resilience and how the youths are actually working to impact mental health in our community. So we have a question for you here before you go off. It says you're leading a youth-centered project. Could you share how this initiative is tackling stigma and promoting resilience amongst the young people?
Thank you so much. Sorry, I didn't add it when talking about my
Okay.
intro. So the question, like, if I got it well, it said that I'm leading a youth-centered project under Millennium Fellowship, and
Mm-hmm.
you want me to share with you how this initiative is tackling stigma and promoting resilience among young people. Am I right?
Yes, please go ahead.
So thank you so much. Talking about this initiative of mine. Firstly, I'm working with the different youth-led organization here in at the campus, and I'm also going for mental health awareness in the uh, different communities around my campus, where I'm currently taking my studies is in the south of Rwanda, and what I'm doing within my with my project, I'm like educating youth and telling them all about what's mental health, telling them that these mental health issues are preventing them to express their full potential. These mental health are like making them uh, go to seek refuge in the in different habits which are not good for their health. So since you find that different people in the community, when they feel that they are not having a good feeling, like if their mental health is messed up, they go to seek refuge in in alcohol. They go to seek refuge in different bad habits. So what I'm doing now is that uh, I'm trying to like make them uh, connected to different support systems that can be helping them different support system that will be able to promote their health. And how I'm tackling stigma and promoting resilience among these people. It's just like telling them their potential, telling them how if their mental health is great, if their mental health is good, in their if they are in fully mental well-being, they could be able to practice their full potential. They could be able to cope with uh, normal life stress, and they could be able to like to like practice their full potential. So the
Okay.
stigma around this mental health within the community, you find that many youth, as I said in my presentation, are like considered of low self-esteem if they communicate about how they are feeling, if they like tell anyone how they are feeling, and if they seek they like if they seek help, you find them like considered as of a very low, like, if I can say, they are considered not to be men. So I'm trying to like cut off these all stereotypes, and I'm uh, trying to let them that know that different groups can help them like promote their mental well-being and express their full potential. That is it.
Thank you very much. Thank you very much. That is a misconception that really needs to be cleared so that men, especially, can be open to seeking for help. So, we have another question here for our psychiatrist. It says, psychology. Okay, from your experience, how can psychologists and policymakers collaborate more effectively to scale up mental health care?
Okay, hi. I'm a psychologist, though, not a psychiatrist.
A psychologist, sorry.
Yes. Oh, that's fine. Okay, so psychologists and policymakers can basically collaborate effectively by literally doing what we have been talking about here. We bridge the evidence with action. So we go with the research, the findings, clinical insights, community perspective, and we take this to the policymakers by having roundtable meetings, involving them in the whole process that we've started, and they would bring resources, they will bring authority and a way to implement laws. So to make it more or less compulsory for everybody, prioritizing their mental health, also making a law where if anybody is being violated or abused emotionally, because according to the Violence Prohibition Act, Violence Against Person Prohibition Act, that's the VAP law. So I can remember when this law was being transferred to like states in Nigeria, we had meetings with policymakers because as an organization that focuses on community mental health and also their rights as women and little girls or youth women. So these are things that we can do when we work together. We can co-create programs that are culturally relevant and sustainable. So that's when we have like regular dialogue. We meet to talk about things that we've had previously, the aftermath, the outcome, how it has basically prevented a mental illness in this community. So we, as we are involving the community members, we are also carrying the policymakers along. So this is where you are putting your money into, and this is how it is actually helping people in this community. We are doing monitoring and evaluation maybe every other year, just to not just to ensure that these policymakers, they can see value for their money. They can also see that this is actually helping people in this community. If they can see the impact, they would by themselves take it to other communities without our intervention. So there is a lot psychologists and policymakers can do to promote mental health care, to support the citizens in that community, the people, inhabitants of that community. But we need to work together. That is where we can meet at the middle, right? As a psychologist, I meet the local government chairman of my community and tell him, okay, in this community, I've noticed this and this are happening. And I would really want you to ensure that in when they go to the primary health care in this community, there is a level of confidentiality because people are not really talking. They are scared that they get to the hospital and everybody knows their issue because they are all in the community. So if they can put a law that makes sure the primary health care center, the doctors there are very, very intentional, right? They don't just ignore people. I can remember, oh, now I'm taking time. So there are a lot of cases that we've handled in where I work. So we can actually do a lot of things as psychologists and policymakers when we collaborate effectively by bringing in, most importantly, our research as psychologists, our findings, what we have seen, clinical experiences, lived experiences. We take it to these policy people. They will know the gravity and they would respond because when they cannot really tell the effect it is having from for example maternal mortality. They really know how people are dying, women are dying. But then as a doctor, if you carry your research and go there and give valid and vivid imagery, they would have a change of heart. They are not wicked. They would have a change of heart. So I think that answers the question. Thank you.
Thank you. Thank you very much. Thank you so much for that. It's we could see the passion there. You made us understand collaboration is key. We need to show them the research and so that they know the action to take. Uh we we have a question for Mrs. Visola. I think she has left the chat. Wow, I see that we've taken lots of time. We apologize for keeping you this long. The questions remaining, we're going to drop the answers on the recorded channel. So please, you can follow Firat on YouTube for the recordings from this session and also for responses that are going to be dropped by that. I will personally send a message to her so that she can actually respond. So, with this, we thank you so much, everyone, for coming. We've learned so much today. We've learned that mental health advocacy, it must link research evidence and community action, and we need to collaborate across all age group. We can see the youth advocate is here. He has told us about how they are working to to reduce stigma and also promote resilience amongst the youth. And remember, the youth are the future of tomorrow. And we have mentally well youth growing up to become adult, to become older population. You know that the mental health system is going to be balanced. We know there is no health without mental health. It's not about being psycho, it's not about being mad, but it's a holistic thing. Physical health, mental health, emotional health, all together is actually the holistic plan for mental well-being. We have Mrs. Bisola is back. Please, are you still here? Can you hear us? Hello, are
Yes, I
you
can
here?
hear you. Yeah, I can
Okay,
hear
please,
you.
we have one more question for you. We just in 1 minute so that we can continue to the end of the program. It said that stigma remains a major barrier to seeking help. What practical steps can communities take to create more supportive and inclusive environment for people facing mental health challenges?
Okay, thank you so much. So, like I said earlier on, number one, I think community awareness. Going into the community to second aspect, I wanted to make mention of lived experience, past experience. When you go into the community, tell the people in the community that even part of us that we are researchers, we have persons with lived experience amidst us. There is this kind of surprise that you will see on their faces, and they will kind to wonder. Some will even say it's a lie, it's not possible. When you give them this beacon of hope that this situation is not hopeless, the right care and treatment, he will be just like any other person and will be able to attain his potential. So when they see this in a practical way and they see someone that has faced what they are passing through and has become somebody in life, this will cheer them up, collaborate with you and make sure that the people that are involved in the community the right treatment and help. So they just need awareness, sensitization. They just need stories of hope from persons living with mental illness. And this can make them to believe that there is more for that person that has this kind of illness in their community. Thank you.
Thank you very much. That point of lived experience as a bridge is very powerful because I know that once you tell someone you have been through this, it creates this level of trust and the person can open up. The person can actually believe that there is hope for them. Thank you so much. I hope that answered the question. And with that, it has we come to the end of our program. On our team today, from research to action, bridging the gap between evidence and community healing. This topic actually goes to the heart of advocacy. We are not short of research work. We have so many statistics, we have so many research work, but all this evidence cannot heal people. We need to bring it down to the community. We need to communicate with the people. We need to take these interventions back to the heart of the community. So we have learned so much today. Thank you so much, our able speakers, for giving us very insightful sessions. And with that, we come to the end of our lunch series for Mental Health Dialogue series on Fire Arts. You can follow us on LinkedIn, on YouTube. We have several other dialogue series. We have the maternal and child health dialogue series. We have the nurse's diary. We have the research work, all on Fire Arts. So if you follow us on our YouTube channel, on our LinkedIn, Twitter, Facebook, you get more information on our next program. So we'll see you next month on our second episode of the mental health series. If you have registered, you will receive emails, you receive messages reminding you of our event. But if you haven't, please be on the lookout for our posters and information. Thank you so much, everyone. Have a lovely evening and have a great week ahead. Thank you.